The Joint Commission of Taiwan, JCT, was established in 1999. It was jointly funded by the Ministry of Health and Welfare, Taiwan Hospital Association, Taiwan Non-Governmental Hospital and Clinics Association, and Taiwan Medical Association. The establishment purposes are to assist promotion and execution of Taiwan healthcare quality policy and healthcare quality certification. Because of JCT, excellent healthcare quality and medical education in Taiwan are renowned worldwide. Due to its reputation, many foreign friends come and visit Taiwan. What is the labor division like within JCT? Since the establishment of JCT, it has been entrusted by the Ministry of Health and Welfare to handle regional hospital accreditation work. Since 2000, it has expanded to handle regional hospital accreditation and psychiatric hospital accreditation works. The accreditation of JCT is directed at hospitals' quality healthcare, doing in-depth multivariate analysis and evaluation. In order to ensure the accreditation is objective and neutral, the JCT assists the Ministry of Health and Welfare in employment, training, and appraisal systems for Hospital Accreditation Committee members. Accreditation Committee members must accept numerous trainings. They are not only required to understand the meaning, purpose, history, and current situation of hospital accreditation, but are also trained with interdisciplinary, diversity, and macro-evaluation capability. This way, they can be competent for the important task of accreditation. In view of the professionalism to execute accreditation, in 2006, JCT obtained international certification by ISQUA. It was the first agency that had passed the certification system in Asia. Later on, Hospital Accreditation Standard Certification of JCT had become synchronous with international standards. It has been affirmed for organizational operations and evaluation processes. The mission of JCT is to make the public enjoy safe and high-quality healthcare. Under this perquisite, quality of all hospitals and clinics is the primary topic. Therefore, the Quality Group assists hospitals in an in-depth way to strengthen healthcare system, environment, and culture with humanistic concern. For example, referring to all kinds of foreign indicator system and applying 10 years' experience of healthcare quality indicators. The Quality Group establishes Taiwan Clinical Performance Indicator, TCPI, with combination of health policies in and outside of Taiwan to assist hospitals in performance monitoring and improvement within the organization. Around 1999, JCT introduced an international indicator project, the International Quality Indicator Project, IQIP, from the U.S. After 10 years of implementation, to achieve the purpose of localization, it started to plan the establishment of Taiwan Clinical Performance Indicator, TCPI. Basically, it's divided into 3 items. One is comprehensive care, one is psychiatric-related indicator, and the other is long-term care. Comprehensive care is divided into hospitalization indicator, surgical indicator, emergency indicator, and ICU indicator, etc. The system doesn't only provide the hospital in organizing their own materials, but also provides overall environment peer indicator data of other hospitals in Taiwan. Therefore, they can make comparison. Each hospital has panel of experts, and they can apply these materials for discussion. For example, 10 years ago, the correct usage of prophylactic antibiotics in Taiwan was just about 60% or more. All hospitals used it as an indicator to monitor and train, or do cause analysis and improvement. Currently, with the efforts of JCT, correct usage of prophylactic antibiotics in Taiwan has been up to near 100%. We regularly monitor our indicators to check whether the tendency has surpassed the threshold. If it has surpassed the threshold, or it has changed, we will aim at the indicator and ask each unit or the whole hospital to do a review and make improvement. For the external aspect, we make comparison on our indicators with other medical centers. For example, we found out in our hospital that bedsore percentage has decreased year by year. However, it is still slightly higher than the average indicator of overall medical centers. We aim at the certain indicator and formulate some improvement methods and propose intervention means. It has reduced the bedsore percentage effectively. The hospital can select which indicator to report independently and be used as a motivator to achieve and improve. Additionally, the quality group holds Healthcare Quality Award competition. It relies on competition to stimulate improvement. The intention of us to hold the competition is to train colleagues in our hospital how to distinguish the problem and then how to improve the problem independently. Originally, the competition was a tool used to promote healthcare quality. However, later on, some hospitals started to introduce 5S or Six Sigma. All kinds of quality control tools were introduced. We felt that quality control circle may not only represent the quality of hospital, but many other aspects can be joined together. Therefore, from then on, we divided it into more group categories. Like this year, there was practical training, realistic scenario simulation competition, with additional evidence-based medicine. We call it evidence-based medicine, EBM contest. That is to say, in our medical industry, especially in clinical medicine, evidence is very important. We want to know whether the hospital has policy to promote overall healthcare quality. Therefore, from then on, we think whether we shall use a systematic concept to judge the healthcare quality of the hospital. So we established a system class award of healthcare quality group. If we have an opportunity to select them to go out and participate in competition of JCT, we're able to communicate and learn mutually with other hospitals. Members outside of the hospital are professional experts. At the moment, any suggestion given to them would be great gains factually when they go back and have a discussion and review. Competition is not an initiation to fight, but is in fact heroes communicating and learning from each other. The quality group does not only select high-quality organization, but has constructed a platform for communication and learning so that organizations can emulate those better and complement each other. For evaluation standards, besides the subject confirmation, the thinking process, policy formulations to the final results are also very important. We also hope the results can be shared by us, so partial points are on whether the hospital has popularized the results. For example, we've participated in a project competition of radial artery hemostasis bruise incident. We used hemostatic cotton and pressurized tourniquet to stop the bleeding. We found that some other hospitals had made improvement on hand pressing part at the moment. We collect all these methods, and it's made a significant improvement on incidence of patient bruise. As the expectation of medical profession rises, so does consumer awareness and regulations. Compared to 10 years ago, the growth of modern healthcare complexity has doubled to the point of making its clinicians feel breathless. Therefore, JCT launched the Smart Hospital Competition. It is expected to combine hospital with technical industry to create a favorable environment to continuously pursue the improvement of healthcare jointly, and to improve efficiency of clinical staffs and reduce their workload at the same time. In addition to the indicator system and competition mechanism, the quality group is also responsible for training professionals and hold various kinds of education and training regularly in order to improve the knowledge and skills of medical personnel in Taiwan and ensure the safety of patients. JCT helped establish a clinical training system after graduating from medical school, for continuous professional development so that novice doctors can be familiar with clinical work under the lead of senior physicians. Everything we've done will be known by both our physician in charge and chief resident, even going as far as expressing concern. On one hand, it can ensure my learning and ensure each treatment is correct. On the other hand, which is more important, patient safety is achieved and confirmed. Besides our clinical work, we will also hold case studies using actual cases to discuss ethical and legal issues or even answer unknown problems. Based on general and basic training to train new physicians, the training period was adjusted from the original 3-month to 6 months. In 2011, it was adjusted to 1-year period of general medical training after graduation. In 2007, this concept of clinical training after graduation was expanded to other categories of medical personnel, covering the practitioners, dentists, nurses, and pharmacists, with a total of 16 categories of medical personnel. They are required to receive 2 years training systematically. 2 years of medical education training not only improve the professionalism of physicians and medical personnel, but also ensure the safety of patients. With these lessons, the government carried out a series of review and revision aiming at infection control measures. In 2008, it entrusted JCT firstly to perform hospital infection control policies and audit quality enhancement plan so as to establish standardized mode on audit operation and strengthen standard consensus. As the saying goes, prevention is better than cure. Caution against small matters is the only way to ensure safety and health of the human body. However, there are still a lot of people who are fearful to do physical examinations, only because they've heard that intestinal perforation has occurred during colonoscopy examination, or they have allergic reactions and other conditions to the developer when performing a CT scan. From the physical examination service environment, such as WC or examination seat, we will adopt fall prevention measures. At each observation point, we must check the information of the subject. Especially if there is invasive examination, it must pass the evaluation of anesthesiology specialists and nurses who have received anesthesia-related training to meet the requirement on overall safety and healthcare quality. As all medical-related matters have passed the certification of JCT, I believe all aspects of medical healthcare are very good, so I choose here. In addition to health examination quality certification, JCT also provides disease care quality certification and aesthetic medicine quality certification. Regardless of certification, they are all patient-centered and use systematic, diversified, and flexible ways to check the operation and execution effectiveness in clinical practice and give the public a little more protection. In recent years, as public awareness of preventive medicine rises, in addition to disease treatment of hospital, JCT also holds health examination quality certification in order for these agencies coming for certification can ensure the consistency level on safety and efficiency for their physical examination quality. For foreign residents selecting a physical examination agency in Taiwan, there will be a certification mark to make them understand which agencies have passed such evaluation and they can receive high-quality care. In addition to hospital staffs that are required to participate in rigorous and professional training, the public also need to learn how to practice safe medical treatment in order to strengthen performance effectively. So objectives are formulated by JCT and delivered to all hospitals in Taiwan for implementation. Every year, the Patient Safety Week activity is organized according to different projects, so that people in Taiwan can understand the correct concepts regarding drug safety, infection control, surgical safety, fall prevention, and other aspects. So presently, many hospitals in Taiwan cooperate with JCT and have established an excellent reporting system. The hospitals have collected all kinds of patient safety events and reported to the Commission. The most significant meaning is that it doesn't punish individuals. We hope to make systematic improvement from the whole procedure. Factually, it doesn't only focus on the safety of the patient, but also medical personnel in the hospital. 1. Drug safety. Check the identity when requisitioning the drugs and don't stop using medicine at will. 2. Infection control. Wearing masks and washing hands frequently. 3. Surgical safety. Informed consent, patient identification, and verification of operative site. 4. Fall prevention. The patient should be vigilant to protect themselves, and caregivers should pay attention to the patient's condition. In addition to the Patient Safety Week activity held by the hospital, JCT also publicizes correct medical knowledge in communities regularly, hoping the public can come together with medical personnel to enhance healthcare quality in Taiwan. The most important meaning of Patient Safety Week is to make the public understand what the medical world is doing and what efforts they've made for the safety of patients. Furthermore, one huge concept is to hope for the public to cooperate with the hospital to develop this matter better. Every effort and contribution of JCT is a guarantee to the public, from reform of hospital accreditation, patient safety promotion, new medical personnel training, to quality of physical health examination and quality certification of beauty medical products, which all have a perfect and sound system.
And I really trust the service at the hospital. The doctors are friendly, the staff is very friendly, so I don't have any reason not to come back to this hospital. Trust everyone here.
Taiwan is a beautiful treasure island. In addition to cultural beauty and tourism resources, it also has high-quality medical service, which does not only have low medical costs, but is convenient and safe. JCT is the most powerful strength for our firm and health fort.